Hello and welcome to the Tingle Clinic. My name is Dr. Grace and I'm going to do your vision test today. First, I need to take some notes, like your full name. And your age, please. I know, sometimes people get a little bit sensitive about this question, but I do really need your age. Yes. Well, you look very great for your age, don't worry. So, when was your last tingle sensation? Okay. Any preferred trigger? Like visual trigger? Yeah, just the visuals. Okay. 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 Great. Then we got this so far, which is already great. Okay, first, I want to take a closer look at your eyes. That's why I'm going to put on some gloves to keep everything hygienic. Okay, first, I'm just going to slightly touch your face. Don't worry, it's not going to hurt you. Okay? Okay. Okay, your eyes are a little bit swollen. Like they're a little bit irritated, but it's not concerning to me. Like it could be just well, infection is always not good, but it better be an infection than anything else. So let's just continue. I want to do a quick vision test with you. Okay. And I want you to look right at this lamp and follow the lamp. Okay? Okay. Yes, it's going up and down. Okay, you just have to keep your head like still, don't move it. Just your eyes. Okay? Great. Yeah, that works very well. Okay. Okay. Now I need to take a closer look at your pupils. So now I just focus on my nose. Okay? And I'm going to just, yeah, perfect. Just focus on my nose. Like here. Here's my nose. Perfect. Now I want you to follow the light again. Perfect. Going down for a moment and going up. Okay, that's great so far. Now I want you to tell me when my fingers are out of your vision, okay? Okay. Just keep focused and tell me when they're out of your vision. Okay? All right. Okay, now I will go further to you and you tell me when they're out of your vision, okay? Great. Okay, let's continue. Let's repeat that. Can see them no more? Okay, thanks for telling me. So, I think your vision is a little bit not distracted. It's like it's not as good as it has to be. Yes, because normal people can see until here, like my fingers, but for you it's like here, and that's not good. But as I'm still thinking, this is an infection of your eye. I have the right treatment for that. But for that, we need to take a little test. This is a solution that will go right into your eye. This is not going to hurt you or affect you in any way. Your pupils might dilate, like they're getting a little bit bigger, and you look like you just drugged yourself. But that's no problem. You're not going to drive home anyways, do you? Okay. So, I'll give you these eye drops, and then we're going to do a quick vision test with a vision board. You ready? Okay. Okay. Look up for me. Okay. Other side. Look up. Okay. You should blink a few times. Yes, it might feel a little bit weird because it's watery in the eye, but yes. Just blink it. Yeah, that's great. Okay. I already prepared the vision board for you. This is the vision board, and I want you to read a letter for me. Let's say, read, like the first line, just read it out loud, like one by one. Okay. Let's say this one. This line. One by one. Good so far. What about this line? Let's make it very hard for you. Yes, I can hold it like this if it's easier for you. That one. I wanted that one, I think. Like this one. Take your time. Okay, let's make it a little bit easier. Let's go for this one. Yes, right in the middle of the one. That's good. Okay, very well. Can you read anything from that line? Okay, it's okay. No worries. Okay, let's just note that real quick. I don't think you need glasses. Like, I was just thinking about this, but it really looks like an eye infection. You already had that, didn't you? I remember you were here before with an eye infection. That was you, wasn't it? Yeah, I thought so. Okay. We're going to do two things. First, I'm going in with a solution to get out of that, that watery serum things. That watery serum. And then you'll get some eye drops. Okay. What a cute little clown. This can be a little bit distracting to your eye. It might feel weird at first, but that's going to help you. Yeah, just a little cotton swab. I'm not going to put any metal near to your eye. I'm just going in with this cotton swab. Isn't it cute that it's like bluish? Yeah, I do like that. You know, normally in the clinic everything's just very white and not quite playful, but I do like this. Yeah, many patients enjoy that. Okay, let's get a new one. Oh yeah, we have to get a new one because of the hygienic procedure. You know, I also treat like very little patients, like 5-year-old girls and boys, and they do appreciate like the color. Yeah, it takes a little bit, you know, stress away. They really enjoy that. Like their life is so colorful, and then they go into a practice, like everything's just, or they go into the clinic and everything is just white and weird. And there is a illness, it's called white coat illness, and that's really an illness. Like people are going to the clinic and they get a very high blood pressure. They get scared because of the white coats that we are wearing. So it actually can help them if they're like, if the doctor or the nurse, whoever treats them, if they're wearing like their normal clothes, that really helps them to calm down and not feel so anxious about it. It's really, I already saw that. Like I had a few patients that told me that they had the white coat illness. I'm not sure if you call it white coat illness or more like white coat anxiety. I have to look that up actually. But it's really something to be serious about. There are people that say, well, that's not a thing, and you're just, you know, making things up and you're being dramatic, but it's not. It really is something to be serious about. Like sometimes they've had a bad experience in a clinic before, like as a child, maybe many things, many traumas adults have do happen in their childhood actually. So they're coming back after years and they are anxious. So I think it's important to treat every patient with respect. We also do have sometimes patients that are like outrageous, but you know, mostly there's just fear behind that. Like they're feeling they're at a new place, it's not home, they have different food than they're used to, they're different people, it's not home, the family's not here, or even if they are there like just for an hour or two, and they get really anxious and they feel unsafe, like their normal surroundings something very, very different, and they're not comfortable because it's not their home. And then some people, they respond with anger, they get mad at us. So yeah, we have to treat every person with respect and of course help every person out there. That's just our job. Sometimes it really just is fear. No one hates anyone just because the person exists, but they do suffer themselves, and that's why they respond like that. How's your vision? Do you have any pain or tinglish or something, anything? That's the answer I wanted to hear. Then we can continue with the eye drops. Yeah, that's just the clinic eye drop. You will receive your recipe. I will send it home to you, and then you can get your own eye drops yourself. Okay, I want you to look up. Same play again. Okay, another side too. Okay. It's just that easy. Blink a few times for me. How are you feeling? Okay, I want you to take 3 times of the eye drops at 3 times a day, in the morning, during lunchtime, and in the afternoon. 3 times a day, 1 drop per eye. Okay. Well, I want you to get well soon, and I'll see you in your next checkup. Have a great day. Bye.